Hello, and welcome to this piece of bad news for anyone who opts to not use protection. Gonorrhea has now reached a point where it is untreatable. Gonorrhea is a sexually transmitted disease. It is caused by the Neisseria gonorrhoea. Although some people are asymptomatic, others experience pain while urinating, discharge, and reproductive problems. It can spread to your heart and joints if left untreated. It is one of the most common diseases in the world, with roughly 78 million new cases diagnosed each year. 30% of these are resistant to at least one medication. It is transmitted by sexual contact with an infected individual, any kind of sexual contact. There is also a possible pathway involving vaginal birthing of children. It is diagnosed by testing urine for a positive gram stain and a swab for bacterial culture. These cultures can be used to establish antibiotic resistance. Newer procedures involve genetic testing. Gonorrhea affects roughly 0.8% of women and 0.6% of men. They are usually treated with ceftriaxone by injection and azithromycin by oral. Infections in women mostly occur when they are young adults, and similarly for men. In 2015, it caused about 700 deaths. With that knowledge, the poor bastard who is currently being treated with backup drugs being injected directly and in higher doses than usual is the first patient who is known to not only be untreatable, but to have had sex, thereby spreading it to his partner. This is a problem. There are some things in the world you want to be the first of. First person on the moon, first person to break a record. You do not want to be the first person to wind up with an untreatable STD. This is a prospective reproductive time bomb. Newer generations where children are born infected with treatment-proof infections. They then carry it for life if they do not die. It'll be just like the koalas, except in their case they have a genetic susceptibility to chlamydia. In the case of humans, it may well be that there is a very quick spread of a treatment-resistant, if not untreatable, form of gonorrhea in the near future. This is bizarrely true in the UK, where there is an unusually high prevalence of young people with gonorrhea. There is a ray of hope though. In the near future, it may be less of a problem than it is now. A vaccine has been developed for gonorrhea and tested in mice. It may move into human trials once the safety has been established, as that has yet to occur. However, once it does, given the circumstances, it is likely to be streamlined and be made available to the public that much sooner, given the nature of its need. Do not forget, under the circumstances, you have only two options if you plan to continue using your reproductive system. Either use protection or do not participate. Thank you for watching. Please post any comments, questions, or suggestions you may have below.